Interprofessional communication is a key aspect of health service delivery, which involves the communication of healthcare professionals between themselves, their patients, family members, and the broader community in a holistic and collaborative way in order to ensure the best possible outcomes for consumers of the healthcare service. Mutual respect between healthcare services is essential for interprofessional communication to occur. There are significant numbers of studies which show that if there is not mutual respect between professionals, it can have a detrimental effect to their patients. There are a number of different aspects that are combined to make up interprofessional communication. Being aware of these is essential to ensure that communication is optimized. The three aspects that make up interprofessional communication are as follows: verbal communication, non-verbal communication, and written communication. Verbal communication is the most common form used in healthcare. In the interprofessional setting, this is usually seen in the form of a clinical handover. Clinical handover is a process of one healthcare professional communicating important information about their patient to another healthcare professional. Each different profession has a slightly different model used to format a clinical handover. However, the most common model used within paramedicine is the IMIST-AMBO model. IMIST-AMBO stands for the following. The I stands for identification. In this section, the paramedic will identify their patient by providing their name, age, and address. M stands for mechanism or medical complaint. Here, the paramedic will explain what the mechanism of injury was or what the current medical complaint is. I stands for injuries and information relevant to the complaint. Here, the paramedic will provide information on the patient assessment and the history relevant to the presenting problem. S stands for signs. Here, the paramedic will relay the vital signs and level of consciousness of their patient. T stands for treatment and trends. Here, the paramedic will talk about the interventions and the response the patient had to the treatment given. A stands for allergies. Here, the paramedic will talk about any allergies that the patient may have. M stands for medications. In this section, the paramedic will talk about what medications the patient currently takes. B stands for background. In this section, the paramedic will talk about the patient's medical history. And O stands for other. Here, the paramedic will talk about the characteristics of the scene, the social situation of the patient, whether or not the patient has an advanced healthcare directive, and whether the patient has brought any belongings or valuables with them to the hospital or healthcare service. This format proves to be quite effective as it includes all the important details that need to be communicated to other healthcare professionals in order for them to get a complete picture of the patient and the events that have occurred for the patient to be admitted to hospital. Nonverbal communication is just as important as verbal communication, and if close attention is not paid to this, it may be difficult to build rapport with other healthcare professionals, and therefore may prove to be a blockade to effective communication. There are many different forms of nonverbal communication, some of which are facial expressions, eye contact, gestures, body positioning, voice, space, and many others. Each of these plays a role in forming effective communication. Written communication can occur in a number of different ways. However, in the healthcare setting, this usually occurs in the form of clinical notes. These include all the relevant and pertinent information about the patient and the events of the case. This form of communication ensures that there is an accurate record of the care provided to the patient, along with everything that occurred, which can be used as evidence in the case that there may be a complaint from the patient about the care they received from the paramedic. It also ensures that the appropriate information has been given to the hospital or other healthcare facility that will be taking over the care of the patient. Interprofessional communication is absolutely vital in providing appropriate and effective healthcare. There are numerous studies which prove that ineffective communication between healthcare professionals results in poorer patient outcomes. It is important that healthcare professionals take into account the previously mentioned aspects of communication, as each of these works together to form a rapport between clinicians and ensure that all the pertinent information is transferred from the paramedic to the healthcare team who will be taking over the care of the patient. When information is misconstrued or misinterpreted, it can have detrimental effects to the patient. Miscommunication can lead to the misdiagnoses of the patient, which may result in them being provided with treatment they do not require or treatment they do require being withheld. Along with this, miscommunication may lead to medication errors, injury to the patient, and in extreme circumstances, death. All of this can be avoided by clear and effective interprofessional communication. In saying this, there are a number of barriers to effective communication between paramedics and other healthcare professionals. Due to the fact that paramedics more than often work with triage nurses, emergency department nurses, and trauma teams, it is no wonder that sometimes information is lost during handover. The emergency department is a very busy environment. It is crowded and noisy, and the process of handover is often interrupted, whether this be by other paramedics, phone calls, patients, or other hospital staff. Any interruption may result in the loss of important information. Along with this, the staff of the emergency department are burdened with a heavy workload and must multitask to ensure that they stay on schedule. All of this combined leads to an environment which is not conducive to effective communication. This is precisely why it is so important to ensure that every form of communication is utilized so that every piece of information is translated, as it is vital for good patient outcomes. As the paramedic is the first healthcare professional to care for a patient, it is their duty to ensure that the correct information is construed to the triage team and the treating teams, as this will determine whether or not the patient is referred to the correct treatment area. If this does not occur, the patient may not receive the appropriate care for their current situation. One way interprofessional communication could be improved would be for paramedics to all use the same format of handover. There is a large number of paramedics who do not use a handover model, which leads to confusing, repetitive, or inconsistent communication. If each paramedic used the same handover model, there will be a much lower rate of misinformation being given, which ultimately would improve patient outcomes. Another way to improve communication between healthcare professionals is to limit the use of jargon. Jargon can be quite personalized to each individual and therefore may have different meanings to each clinician, which can drastically change the information being given and received. For example, I recently witnessed a clinical handover between a paramedic and a triage nurse, in which the paramedic referred to the patient as being slightly tacky. In this instance, the paramedic meant that the patient was tachypneic. However, the triage nurse took this to mean that the patient was tachycardic. and it was not until the end of the handover that the mistake was realized. This shows the importance of using correct and direct terminology that will not be misconstrued by the receiving party, as any slight misinterpretation can drastically change the patient's treatment plan, as previously mentioned. To conclude, interprofessional communication is one of the most important tools to be utilized when caring for patients. The quality of communication has been proven to drastically increase or diminish patient outcomes, and therefore it is vital that healthcare professionals strive to improve upon their interprofessional communication skills. As a paramedic student, I believe this to be an absolutely vital component of the profession and believe there is always room for improvement when it comes to communication.